The broadcast is now starting. All attendees are in listen-only mode.
All right, thank you everyone, and welcome to another EBFA webinar. My name is Dr. Splichal. I am the founder and CEO of EBFA. I write a lot of our education. If this is your first time tuning in for one of our webinars, thank you for tuning in. And if you are one of our returning listeners and certified professionals, then thank you for always supporting EBFA and the education that we put out. It is my goal through all of our education to help you help others by providing evidence-based education that is sound in fascial fitness, barefoot science, and of course, brain, breath, and barefoot. So before we jump into today's topic, just some brief housekeeping. This is being recorded. So if for some reason you lose connection or need to jump off for any reason, or you want to re-listen just to hear some of the topics again, then please note that it is recorded. All of our webinars are found on our YouTube channel, which is youtube.com/EBFA Fitness, but then they are also housed on our Teachable page as well. I will give that URL at the end, just in case if you want to follow this webinar or any of our others. After I go into the content and complete that, then we will do some Q&A. So have your questions ready throughout. You may type those into the chat box, and then I will answer as many as I can. And just in case you lose connection or jump off for any reason and you have a question, then you may always email me as well. So here we go. Real quick, my background again before we jump into the topic. If this is your first time tuning into an EBFA webinar, please know a little bit about my background. It helps to understand the perspective of how we write our education. I am a podiatrist, but I am much more of a functional podiatrist. So I try to look at the human body in a very integrated way. This means that I look at the body in dynamic movement, thinking gait, walking, step up, step down. I get my patients out of the chair, and then also from a functional medicine perspective. So I do try to factor in inflammation levels with my patients, their sleep cycle, their mind-body connection, their gut biome, everything that we know can influence the body. I've written several books, and I'm also the founder of Nebosha, which I'll reference a little bit further into the webinar when we talk about texture and impact forces. Now, if you would like this PowerPoint, you may email me at education@ebfafitness.com, and I will definitely get this over to you. And then just know that all of our teachable webinars, you can find the PowerPoint coupled with those recordings as well. So just in case if you forget that email, and then this is the email that you would send any questions to if you may have those. So let's get started in today where we are talking about gravity. Gravity, is it a friend? Is it a foe? How should we be thinking of this relationship with the gravitational field that is in our environment every single day? Now, as movement specialists, we want to be considering this from a slightly different perspective than maybe the average professional. But from a movement perspective, there's a few key foundational concepts that I want to go in that relates to gravity and how we can consider our relationship to gravity. So now, first one, as far as a foundational concept, is that the only constant in this world is gravity. We know that when we wake up the next morning, that gravity is going to be there. And then that gravity is really important from a sensory stimulus. So this is the way that I want you to think of gravity is a sensory stimulus and a sensory driver to how we maintain upright stance, how we maintain balance, and of course, how we move dynamically. Gravity is also going to be a really key role in the transfer of potential energy. So gravity, in addition to be a sensory stimulus, gravity is energy. Now, gravity, again, related to energy. Gravity is what drives dynamic movement. Dynamic functional movement is directly related to our relationship with gravity. And gravity from a dynamic movement perspective, or really a foot perspective, is going to be obviously impact forces. So the interpretation of gravity for foot-ground relationships will be impact forces. And then you could also say that the relationship of gravity from the rest of body awareness is its pressure, it is weight. Weight stimulates your proprioceptive system. It helps to sense stimulus to our vestibular system when we're moving through gravity. So movement in gravity stimulates the vestibular system. So there's different ways that we want to see it, but the gravity is going to be the driver of dynamic movement through potential energy. Now, in utero, the vestibular system is the first sensory input system to develop. And this is important to understand because it's really not, yes, it's the vestibular system, but it's not just that the vestibular system are your ears. So a lot of people will say, oh, it's your ears that develop first, which means that in utero we can hear, which we can, but it's more demonstrating that the sensory stimulus of gravity is beginning to be orientated in utero, and that's really what the vestibular system is. Now, vestibular system being really important, one of the most important input systems for posture and balance, your vestibular system is actually connected to your postural muscles. Your vestibular system is actually connected to your core. So this connection to muscles and core stabilizers and postural tonicity is really important to understand the importance of gravity in our day-to-day movements. And that gravity is what helps to initiate the development of our neuromuscular system and the nervous system. And now as we age, this is in utero, right? We get our vestibular system. Now we age, we get injury. And maybe we lost hearing in one ear and we have an inner ear infection, or we had a stroke, or we have neuropathy. All of these things are potentially creating injury or deficits to our perception of gravity and the sensory stimulus of gravity. This means that when you're dealing with someone who's had an injury of any of those that I had mentioned, you as the therapist want to ask yourself, how can I increase gravity for my patient or for my client? What are the techniques and strategy to upregulate their gravitational experience? Some of the ways that we can use gravity or increase gravity to upregulate their sensory stimulus is by using weighted vests or wrist weights. And I use this a lot in my patients who have movement disorders. So if you have someone who has dystonia or Parkinson's, or had a stroke on one side, they're losing body awareness. So this would be anyone who's at a fall risk as well, is you want to upregulate their awareness of their body in space. Adding wrist weights does that. That helps them to feel where their limb is in space. Weighted vests help to give a total body awareness of where their body is in space. And that's something very important, and something that I focus on from a fall reduction perspective is that my step one in reducing falls in individuals that are very complex and have a lot of comorbidities is you want to just start with the most basic baseline of body awareness. Let them feel where their body is in space. That would be, like I said, wrist weights, weighted vests, diaphragmatic breathing, just interoceptively feel where their body is in space again, because that's a lot of where this fall risk is happening, is that they lose that body awareness. And if we lose body awareness, we're not able to sense any shift in that body quick enough to then prevent that fall. So now, from another foundational concept is sensory input. Sensory input meaning gravity or ground reaction forces, which is still gravity, is going to be the sensory input that drives and shapes and optimizes the motor output. Sensory must precede motor. So our role as movement specialists is to ask ourselves and to create programming that optimizes the sensory stimulation for dynamic movement. Weighted vests, put them in the water. That's another great one. When we are in water, we have a heightened body awareness because of the pressure of the water and the water touching the skin, all of the skin. It's great for children who are low tone, or children who are lacking some sensory connection, to those who are had a stroke or have other neurological deficits. So upregulate that sensory, get them out of their shoes, have them barefoot, put them on Nebosha, use whole body vibration, use percussion, use kinesiology tape. All of that is going to upregulate the sensory input to drive their motor output. Because at the end of the day, what you are training is the nervous system, the neurological system, the brain, the central nervous system, and the peripheral nervous system. This is what we're training to optimize movement, and this is ultimately what gravity is stimulating when we are encountering it. So, of course, being a podiatrist, we want to focus on that relationship with gravity as it relates to the foot. And if you've taken any courses with me before or any lectures, this should be an awesome review for you. You should be able to teach this now, hopefully, so that that's demonstrating that you fully understand, not memorize, but you understand what it means to have this relationship between the foot and the ground. That's honestly where I get a lot of my referrals, is that doctors that have exhausted their patient's response to non-responding back pain or SI joint pain or hip labral issues or knee pain, and they'll refer them to me and say, maybe I'm missing something. Go see Dr. Splichal and have her do a gait assessment and a movement assessment, and maybe it's something with the way your foot reacts to the ground and relates to the ground. And interestingly, it often is. So we want to understand that gravity-ground relationships are interpreted or converted or sensed as the ground reaction forces or the impact forces. And this I want you to see as important, as necessary. It is the foundational concept of what shapes our ability to walk, run, and do dynamic movement, which means we need to sense these impact forces. We need impact forces. If we did not have impact forces, that means we did not have gravity, and gravity is what provides us the sensory stimulation for dynamic movement. So if we look at a little bit of the numbers, your walking impact forces are 1.5 times your body weight. Running impact forces are obviously going to be higher, because running is essentially just a series of single leg squats or single leg hop squats in a sense. Now, when you have your clients or patients do something that's a little bit more ballistic, like box jumps, now we're getting to 8 to 10 times your body weight. And then if you look at gymnasts who are doing tumbling passes can bring up to 14 to 18 times their body weight, which is really cool to show how much force the human body can withstand and be totally fine. And it's really the gymnast's ability to bring in 18 times their body weight that allows them to do a triple back or some of these incredible tumbling passes. If we did not bring in impact forces like that, we would not see that type of output, that type of skill or jump or height that we are getting in certain sports. So impact forces are necessary. So that is where you want to think about let's say you have an athlete or a client and they're walking, running, they're an athlete that's jumping, or maybe they're a gymnast, and you're thinking that how can you optimize their motor output? You then want to say, I want to ask myself, what is the quality of perception or the quality of sensory stimulation that they are experiencing? Are they truly experiencing this 1.5 times or 3 times their body weight? And or is there a surface or a footwear or a mat or a flooring system that is potentially taking away some of that sensory input, or blocking it or interfering it? That is step one, right? What is the potential for their ability to feel these impact forces? And then if you know that 1.5 times their body weight is coming in, then you want to ask yourself, what is going on with their ability to sense it? So we know it's coming in. They don't have cushion in their shoes. They're not on a wrestling mat, or they're not on concrete, right? So we are controlling the surface and any sort of interface. But then you want to ask yourself, what has to do with their ability to perceive it? If they have neuropathy, they're not going to perceive that sensory stimulus coming in the same way as someone who doesn't have neuropathy. So you may need to say, well, since they have neuropathy, they can't perceive 1.5 times their body weight. I need to upregulate this and make sure that they are actually feeling more. I got to turn up the noise so they actually get enough information to control their motor output. Okay. And then, of course, you need to be able to control the energy that is coming in. And that's going to be our next conversation. Okay. Now, in addition to just the degree of impact that is coming in, this is where anyone who's taken my course before, I hope that you remember these numbers. So you have walking impact forces that are coming in less than 50 milliseconds. You have running impact forces coming in less than 20 milliseconds. Running impact forces are obviously coming in faster than walking. Now, what does this mean? How do I put this into perspective? Okay. Your fast twitch muscle fibers do not reach their peak contraction until 70 milliseconds. So let's just go through these numbers again. If your muscles, which we're going to go over, your muscles are necessary to absorb and damp impact forces, but your muscles don't contract until 70 milliseconds. Impact comes in 50 milliseconds or 20 milliseconds. So essentially, impact is coming in faster than your muscles can contract and essentially react to impact. What this means is that we cannot react to impact. We must be contracting and absorbing and anticipating the impact before our foot even strikes the ground. If we are reacting to impact, this is where we see our injuries. This is where we are seeing everything start to break down. Any of my patients that are coming in that have stress fractures or plantar fasciitis or Achilles tendonitis, shin splints, I know that they are reacting to impact. Now, do I know the reason why they're reacting to impact? Not necessarily. I need to dive in a little bit deeper. Okay. What potentially could cause someone to react to impact could be cushion in their shoes. It could be that they are they've been in shoes for years and they don't do any sort of barefoot or intrinsic strengthening, so their foot is a little bit delayed and weaker. It could be that they have an overpronated foot, so the foot is a little bit hypermobile and unstable. It could be that they have neuropathy. It could be that they have, they're a very disconnected, unconscious mover. So there's a couple other things, maybe that a history of injuries, right? So you can start to see where I'm going with this, of what potentially could cause a client or patient to react to impact versus anticipate impact. Okay, so again, we need to anticipate the impact or the ground before our foot even strikes it, which means our clients, our nervous system needs to understand how we even perceive impact forces. This again goes back to, if anyone's done my trainings, you should know the answer. How do we perceive impact forces? I hope you guys are screaming from the rooftop: vibration. Vibration is how you perceive impact forces. Okay, so again, vibration is how your foot, your nervous system perceives vibration when your foot and the ground interact with each other. And it is those vibrations that stimulate nerve endings in the feet and nerve endings in your fascia to create a neuromuscular response. So then the next question that we have related to this is, how do you damp vibration? If we know that we perceive ground reaction forces as vibration, how do we damp it? And I hope, again, anyone who's taken my trainings before, you are shouting from the rooftop that you contract your muscles isometrically. And when you contract your muscles isometrically, you create stiffness within your body. And that stiffness within your muscles actually creates an effect within your fascial system. It creates what is called fascial tension. So this fascial tensioning response is a stiffening response that is almost like a splints that surround your tibia and your fibula, or neuromuscular fascial splints that surround your metatarsals in your foot to create stability. This is a necessary step to damping and absorbing vibration and to putting the potential energy of vibration into your fascia. So let's go a little bit further. So now vibration, already mentioned this, but vibration is perceived by nerves in the bottom of the foot. Vibration is perceived by nerves within your myofascial web. What nerves exactly? The nerves in your feet and in your fascial web that are sensitive to vibration are called your FA1 and FA2 mechanoceptors. These are your Meissner corpuscles and your Pacinian corpuscles. These are sensitive to vibration. Now, other nerves in the bottom of the feet and the palm of the hand are sensitive to other stimulation that plays a very important role in how we absorb impact forces, how we maintain balance, how we know how hard we're striking the ground. So they all have this integral role in dynamic movement. So now foot awareness and impact forces is necessary to absorbing gravity. The more foot aware, almost like body awareness with the wrist weights and body awareness with the weighted vests, right? You have foot awareness, and foot awareness is built through barefoot training, minimal shoes, and using products such as Nebosha technology, maybe kinesio tape on your feet, maybe some sort of whole body vibration platform, maybe pebbles that you walk across, right? All of those are used to enhance foot awareness or the kinesthetic awareness of the foot, which is very important and necessary to optimizing the absorption and the transfer of impact forces or gravity. Okay, now that should be an integral part of your training. This is something that should be part of any post-injury rehabilitation program, as well as a fall reduction program. An athlete performance program should have foot awareness built into it. Your foot intrinsics have a very integrated relationship to foot awareness, and that relationship is built around the fact that when the skin in the bottom of the feet is stimulated, these small muscles, the intrinsics of the feet, actually contract. And it is these small muscles in the feet, the intrinsics, that play an important role in one, damping vibration, and two, supporting the actual arches of the foot. So they help to stabilize and keep that lift. It's called a plantigrade foot. A plantigrade foot is really an arched foot, the shape of a human foot. Now, you may have seen research studies that show using minimal shoes for a prolonged period will actually increase and hypertrophy the intrinsics of the foot. You can take that exact same concept and say that barefoot training, not just wearing minimal shoes, but barefoot training is going to increase the diameter of the intrinsics of the foot. And then at Nebosha, we would say the same thing, that our insoles bring the barefoot environment into the shoe, which leads to intrinsic muscle contractions. That helps to build stability, absorb impact forces, offset plantar fasciitis, and any other common foot-related injuries. So this is an interesting study to demonstrate the role of texture in the perception or trigger of impact forces. So it's showing that textured insoles actually reduced the vertical loading rate. This is vertical loading rate of impact forces of gravity in those that were running. So that's super interesting to show that even though impact forces are vibration, if you heighten the foot awareness, heightening foot awareness enhances the perception of the vibration to then decrease that vertical loading rate, and therefore you could say reduce injury risk. Yeah, so this is very important to just say, let's just go back here, foot awareness. So whatever you're doing for foot awareness, you could say, if I build in foot awareness with my patients and my athletes and my clients, I'm then going to help them reduce their vertical loading rate when they run or do dynamic movement, which is going to decrease their injury risk. Yeah. Again, at Nebosha, we use textured insoles. I like the textured insoles, not because I developed them, totally biased there, but because it brings a plantar foot stimulation into the shod environment, into the shoe environment. Outside of a vibration insole, it's very hard to bring these other sensory stimuli into the shod environment. And if you don't know Nebosha, you can see a picture of it. So imagine having that on the bottom of the foot when your athlete is running or you're training or you're doing your dynamic movement or even your day-to-day. You will have increased foot awareness, which is then going to decrease your vertical loading rate and have a more accurate foot placement and a more accurate loading and unloading of impact forces. Okay, so just here, very special for you. Please know this is through Sunday, 60% off our insoles, which is ridiculous. You can almost buy 3 for the price of 1. Okay, go to Nebosha Technology, use code rebrand. We have a rebrand that is launching July 20th. So here we go. How do we damp vibration? I already told you the answer. Again, if you've taken my trainings before, please, you should be shouting from the rooftops. We damp vibration through muscular contractions, specifically isometric muscular contractions. And those isometric muscular contractions create tension within your fascia, creating fascial stiffness or fascial tensioning, which creates stability. Okay, take it one step further. What is also happening is that when you contract your muscles isometrically, you actually create pressure. Yes, it is fascial tension, but it is also compartment pressure. So let's take that even further. All of your muscles are housed within muscular compartments. Your core is a compartment, your lower leg is a compartment, your foot has compartments. And all of those muscular compartments are essentially groups of muscles surrounded by a thicker fascia. And then that fascia creates a closed compartment. When the muscles contract isometrically, you are going to get a pressure because you get increased in blood flow. So you get an expansion of the muscle within the compartment. That's pressure increasing, and that pressure creates stiffness. Okay, so it's actually, you could think of it as both. The fascia is tensioning and stiffening, and then within the compartments, you're getting an increase in pressure. Okay, now that increase in pressure is really what is happening when you wear compression sleeves. So an athlete or a runner that uses compression sleeves, what it's doing is it's increasing the compartment pressure to help increase stability to reduce their experience with vibration. That's really how compression sleeves work. Okay, now we mentioned it a little bit as far as footwear. If you have cushion in your shoes, the cushion is going to absorb the vibration. Yes, it's taken away your important sensory information. If it takes away the sensory information, you will not know how hard you are striking the ground. Okay, so we want to try to get our clients out of thick, cushy shoes, at least into a transitional cushioned shoe. And if they can tolerate it, then it should be a minimal cushioned shoe. And this is if we're talking in a gym. If you are in a gym environment, literally everyone should be able to tolerate a minimal shoe, a non-cushioned shoe, right? Because we are in a controlled environment. So what we're really looking at is that we need to be able to absorb the impact forces, which is vibration. And then we need to be able to transfer it when we take our next step. So it's a load and an unload. The load is the potential energy. The release is the elastic energy. We load through a isometric contraction, which creates fascial stiffness, and it stores the potential energy in our fascia. And then we release elastic energy through our fascial system. So it's this dancing, every step that we take, we are essentially dancing with our fascia. And what is dancing with us or allowing that dance to happen are the isometric contractions of the muscles that are intertwined by fascia. And that needs to be happening very quickly. So I refer to that as reflexive stabilization, integrated reflexive stabilization. Again, for those who have taken my trainings, you should know this. I want you to be able to teach this and explain this, and I know that you are. So integrated reflexive stabilization. That means that our foot, which has a deep relationship with gravity, gravity in the ground is the foot, has a deep relationship to your center of gravity, which is your core. So your feet, your foot's relationship to gravity has an interrelationship with your body's center of gravity in what I refer to as foot to core sequencing. Foot to core sequencing. And that foot to core sequencing is done via your deep front fascia line. This is what is connecting your feet fascially to your core or center fascially. And again, since we load and unload through fascia, it makes sense that we are going to stabilize through fascia. And that fascia that we stabilize through is your deep front line. Yes? The exercise that we do to activate that deep front line or your foot is short foot. Yes? Of course, we all know short foot, right? Hopefully we know short foot. And short foot is going to be the exercise that connects your feet to your core. It is what helps to ground you or activate the foot intrinsics, which we said plays a very important role in stiffening the foot and stabilizing the foot and creating pressure within inside the foot. And then because it connects fascially to your core, it's going to stabilize your center as well. Okay, if we have time towards the end, I'm going to go briefly into how you would actually activate short foot. Okay, so let's wrap up with when gravity goes bad. So gravity is a good thing, of course, because gravity stimulates your nervous system. It helps to tell your vestibular system where we are in space. It helps to tell your joints, your proprioceptive system. Again, the wrist weights and the weighted vest. It helps to tell your feet into your foot to core pathway in your fascia, that how hard you're striking the ground. It gives you energy. But now what happens when gravity goes bad? And may I add real quick also that gravity, which is vibration, is actually a stimulus to bone density. So gravity is what builds our bones. Really important to remember that as well. It is vibration that builds bone. So it's that aspect of gravity that is necessary. So just being in gravity and not moving in gravity does not necessarily build bone density. You have to be in a gravitational field, and then you have to move in gravity, because it's the vibration of gravity that stimulates what's called an osteoblast. Okay, now to demonstrate the importance of that, when we have a patient that has a fracture or they had surgery and we want to accelerate their bone healing, we will actually use a bone stimulator, which is essentially inducing vibrations around the fracture site to accelerate bone healing. Okay, so it helps give you perspective. Now, when gravity goes bad, this is really in the relationship to impact forces. This is where we will get stress fractures, plantar fasciitis, Achilles tendonitis. And even though vibration is good to your bones, it builds bone density, if you have excessive vibration or you do not have sufficient stiffness around a bone, then that is where gravity can go bad. This is where we also saw that a lot of the running shoe companies started to look at the need for cushion, because they were looking at gravity as bad. They saw gravity, excessive gravity or excessive impact forces, is causing a lot of the running related injuries, when in fact it was not just the excessive vibration coming in, which is excessive gravity, but it was actually a delayed in the contraction of the muscles in response to the vibration, or it is that we are hitting a fatigue point and the muscles are just getting tired and we need to strengthen them. So I look at it much more as we need to build in foot strengthening, intrinsic strengthening, myofascial strengthening, foot awareness, body awareness training to then reduce gravitational related injuries or overuse impact related injuries. Okay, great. So as we wrap up, what I want to do is go back here real quick to the short foot slide and go over this real quick with you guys. So now, short foot, if you are not familiar with short foot, shame on you, just kidding, small joke. So short foot is my go-to exercise. It is very simple to do, very simple to integrate. And the way that you can think of it is essentially just pushing your toes down into the ground and you anchor or you root. So what I want you to do, if you could join me, this will take just one moment. So if you're familiar with short foot, just hang out with me for just 1 minute. And I want to just briefly explain it for those that may not be familiar with short foot. Okay, so if you stand up and you get into a split stance position, your right leg is forward, your left leg is back. I want you to soften your knees. And then on the front foot, I want you to find your foot tripod and then do the same thing on your back foot. So find your foot tripod and then lift the toes, spread them out and place them back down on the ground. Let's start by focusing just on the front foot. I want you to push the tips of your toes down into the ground, just the tips of the toes, like you're trying to push the toenail down. Now hold that, and can you start to push the tips of the toes on your back foot down? Okay, so now we have a split stance and we're pushing the toes down on both, and then release both feet. Okay, and then we do that again. Okay, push the tips of the toes on your right foot down, hold it, and then push the tips of your left foot down, hold it, and then release. Okay, and you can keep doing that as I'm talking, so just keep doing that. Now, every time you do that, what I want you to feel and even see is that you get an increase in the arch of your foot. Maybe you even see the muscles along the inside of your arch start to hypertrophy or engage. You can see them contract. Okay, that would be your abductor hallucis. And yes, you are getting a slight increase in your medial longitudinal arch as well as your transverse arch. Okay, now let's switch sides. The left leg goes forward, right leg goes back, same thing. Knees are soft. Find the foot tripod on both feet. Lift the toes on both feet, spread them out, place it down on both feet. Stay there. Push your left toes down and hold. Push your right toes down and hold, and then release both. And then do it again. Left toes go down, right toes go down, and then release both. And you may continue while I'm talking. Okay. Now, why we're doing a split stance position is I like to be in a position that mimics gait. Why we start with one foot at a time is I like to build mind muscle connection, and it's much easier to do when you do 1 foot at a time. Okay. If you had your client and you were just trying to get both feet same time, it's very difficult for a client or a patient to connect to that. It's a little bit easier for us, the trainer, to do that, or the therapist, but for the patient or the athlete, it can be quite difficult. Okay, now let's go to the first side again. Right leg forward, left leg back, same position. Knees soft, foot tripod, both feet, lift toes, both feet, boom. Okay, go down. All right, now I want you to engage your core. Okay, so I just engaged my TVA and I lifted my levator ani, if you know how to do that. So engage your TVA, and then your levator ani is like if you stop your poo. Okay, sorry to be blunt, but it is what it is. Okay, so hold that and then stay there. Push your right toes down, push your left toes down, hold, and then just release everything. And then do that again with me. Engage your TVA, engage your posterior pelvic floor, levator ani, hold there. Push your right toes down, push your left toes down, hold there, and then just stay there for a second. Do you feel like there's this connection that's happening? And then release both. Okay. What we are doing is we are starting to activate the both ends of your deep front line. Okay. Let's go to the left side just one time and then we're going into questions. What we're doing on the left side is I'm going to add your tongue into this series. So left leg forward, right leg back, knees are soft, foot tripod, lift toes, spread them down, place it down. Good. Okay. Now, same thing. Engage TVA, lift levator ani, push your left toes down, push your right toes down, stay there. And now put your tongue into your pellet. And just stay there for a minute. Do you feel stacked, connected, stable, right? Integrated. What other words you could come up with? Yes? And then release both. And you can even shut your eyes, and sometimes that helps to connect to the body more. TVA, posterior pelvic floor, levator ani, left toes, right toes, stay there, tongue to pellet. Make a fist if you want also. And then as you're staying there, do you feel relaxed? You should be relaxed. So you're strong but relaxed. You're stable but relaxed. It is your center internal fascial core that we just engaged. It is stacking all of the arches of the body, your foot arch, your pelvic floor arch, your diaphragm arch, and then the pellet of your mouth arch. In yoga, these are called bandhas, and we're essentially stacking your bandhas. Yes? So that gives you a slight tease to short foot, how I use short foot to access the deep front line, to create fascial tension, to create a increased stability from a fascial perspective. And then because your fascia is sensory rich and is sensitive to the pressure of gravity, to the weight of gravity, to the vibration of gravity, fascia is your gravitational tissue. It helps to connect you to yourself. So the more connected you are to your fascia, the more connected you are to your body awareness, your self of awareness in space, and internal body awareness. And then that helps you to move better and feel more connected. Whew, I am done talking here. Okay, so let's get going with any questions that you guys might have. Also, FYI, this is the URL, ebfaglobal.teachable.com. That is the URL for all of EBFA's online education. So I know 2020 is a little crazy year, so please do think of EBFA Online for your education, of course, moving forward, but especially through 2020. We have 2 new courses that are launching. These are super, super exciting. Bear workout. This is our barefoot balance training workout. That is the only barefoot balance training workout that is on the market or in the industry. That launches July 27th. You can register for that now on ebfaglobal.teachable.com. And then we have a course that I'm going to open the registration this week. It is for an interoceptive performance specialist. What the heck is that? And that is essentially looking at internal sensory environment and how that relates to performance and human optimization. So of course, we're looking at the autonomic nervous system. We're looking at the visceral gut aspect of things, and then how it relates to the exteroceptive system. So exteroceptive, interoceptive relationships from a neuroscience perspective and a performance perspective. So stay tuned for that. Okay, great. If you guys have any questions, please do type those in. Excellent. Okay. I have older clients. I have a client who is 70, and I'm looking at who looks at the ground to walk. Is this because of the vestibular system is failing or simply fear of falling? Problem. So yes, that's a really good question, and I see this a lot with my patients. Is if you have a client little bit older or had a certain injury and they look at where they walk, they look at where they're putting their feet, so their head is angled down, that can be because they have lost a foot/body awareness. They have lost literally everything I was just speaking about. They have lost that kinesthetic awareness of where their foot is in space. When I have a patient like this, older or maybe has neuropathy, or I see quite a few young patients with Charcot-Marie-Tooth, which is a motor/sensory neuropathy, they will classically do this. And you know that also someone who has decreased foot/body awareness, they walk very hard, like they kind of slap their feet down and they don't even realize. So what I do for them is I get them actually out of cushioned shoes. Be very mindful, and I'm going to talk about that more in a second. Get them out of the cushioned shoes into a more minimal shoe. But because they are striking the ground harder than potentially they should be because of a lack of awareness, you need to be very mindful, and you have to upregulate something to get them even more foot connected. This is where I use Nebosha insoles. So I get them into, say, like a Vivo barefoot, put the Nebosha insoles in them so they have less cushion but more sensory. You do want to be careful of just taking them out of cushion and into minimal, because they can get stress fractures. And if you have someone who's older, they probably have osteopenia or lower bone density also. So you don't want to potentially cause a stress fracture because they were so used to the cushion and they have decreased body awareness that now they have a stress fracture. Other things that I do is I will do barefoot training. I do foot body awareness training. And then I actually train them facing a mirror. So I like to use mirrors to build body awareness in people who have decreased body awareness, because they can actually see their body moving in the mirror and then feel their body moving in the mirror. So an example with the foot is I would have the patient do a step up on a step, but instead of looking down at the step, they're looking at the step in the mirror, and they're doing this barefoot or on a Nebosha mat, or maybe a power plate that's vibrating, something like that. And then I have them use the mirror to build that kinesthetic awareness. So that's more of how I would start to approach it versus thinking it's vestibular. But that is a great question. Thank you. But I apologize. So Michael asked a question. I noticed you mentioned wrist weights and a weighted vest, but not ankle weights. You can absolutely add ankle weights. I do apologize that should be mentioned as well. I will add that these ankle weights and wrist weights, there is quite a few companies now. One is called, I think it's Bella. If you just Google wrist weights, they'll come up, or ankle weights, they'll come up, but I think it's Bella, and they're fashionable wrist and ankle weights. So in my patients that actually have a movement disorder, I will tell them that you can wear it and it looks like, kind of like jewelry. For the men, it might not look that well, but it looks kind of like a jewelry bracelet, which means that if they truly do have a movement disorder, they could wear it in public and not feel like they're wearing the old-fashioned ones that maybe your mom used when she did Jane Fonda workouts. Okay, so Marilee, great presentation. Thank you so much. Scott, great talk as always. Thank you very much. Can you point out any readings about barefoot exercises, role or mechanism of action for mental health, such as anxiety management, and establish somatic, psychosomatic approaches. So Scott, what I would do is I would start looking at, we have a couple resources on EBFA's online program, which the website is down here, ebfaglobal.teachable.com. And it is biopsychosocial and interoception. If you look at, there's 3 courses that you're going to find on there. It's a free one that's interoception. There is a paid one. It's a 3-hour, and then there's a 4-hour biopsychosocial. And then I believe there's a free one on our YouTube. But those will start to open Pandora's box on this, because there is a lot of important information around barefoot meaning sensory, and barefoot sensory equals safety. So you need to help your patients and clients feel that sensory information equals safety, and it anchors them. So it'll bring them back into a state that they feel safe. We have a few cranial sacral therapists that will use Nebosha's mats and have them feel the mat and say, I am safe, right? They feel the texture. You can use textured things in the hands, and same thing, right? Feel the texture. Even just like stomping your feet down is a sensory stimulation that is going to help anchor the patient from a foot perspective. Okay, and any questions on that, anyone, or for Scott, please just let me know. I have a patient with an osteosynthesis of the talus, and he has problems walking. Are you talking about like an arthroresis, or it's a bony fusion, like a coalition of the talus? If you can be a little bit more specific, Savannah, that would help. That would help. So I'm just gonna wait until Savannah provides more additional information. Brian, thanks for the explanation of the sensory. You're welcome. That explains the cushion in the palms of gloves. I was a catcher, and learning how the cushion impact the ball and the puck in the hand and court. Yeah, great, excellent. Marilee asked a question about the Nebosha insoles. Which would you recommend for someone very active? The 1.5 insole is what we recommend for actually running. And then if you are going to wear day to day or even lifting, then we recommend the Neuro insole. Jeff has a question as far as knee health. I would look at further exploring the knee as it relates to the foot and the core, glute strength. The knee is unfortunately just a joint that's caught in the middle, so it gets the rough end of the deal. Savannah's question, arthritis. Okay, I think that's what you're saying, Savannah. So her client has osteoarthritis in the rear foot, in the talus. There has to be a little bit more on the joint. In the talus, I'm guessing the subtalar joint or potentially the midfoot. Okay, so if you have arthritis in any joint, I'm gonna tie this in so everyone can apply this concept. If you have an older client who has arthritis in their joints, that is going to be very painful for them to move. So you then have to look at their foot as actually restricting motion. I know this is totally counter to what we believe as movement specialists and natural movement specialists, is that we want optimal movement to all of the joints, especially in the foot. We need the foot to move because that's how it absorbs and adapts to the environment. When you have a client or patient that has arthritis and is very painful, any of that excess motion actually can increase their pain because they just literally have no cartilage in these joints. So you do have to look at more stability. We have to work within the reality. So is that orthotics? It might actually be orthotics. Will it be actually having them in a little bit structured shoe? It actually might be. But what you can do is still incorporate sensory to any one that you have to restrict their motion. How can you tie in sensory? You could get barefoot stimulation. They don't have to do crazy dynamic movement, but they could stand in one place. You could put in the insoles. You could do vibration. You could do trigger point release. So different things of how you can bring sensory to the foot, even if you really want to focus on stability because they have an arthritic foot. So I'm so glad that you asked that question, because it is actually important to understand that. We did a training. If you go to this EBFA Global.teachable, it's a free lecture. It's called The Aging Foot. Silvana, I encourage you to check out that free one. And for everyone else, if you want to hear a free lecture about the aging foot and how you can better understand changes that happen with age, and then how you modify your programming around their reality. Okay? It is free. All right, so 2 more questions, and then we're going to let you guys go and have an awesome day. What is the biggest difference between the Nebosha insole compared to the newer version coming out? Oh, because we have a rebrand that is happening. The newer insoles that are happening when we do our rebrand on Monday, July 20th, is purely in the branding, and we have some new colors. The stimulus stays exactly the same. So don't worry about the insoles changing. They're not changing. The color may change, but the stimulus stays exactly the same. All right, last question. Here we go. What do you recommend for a patient that has one hip slightly higher than the other? So they have a limb length discrepancy. This is not the easiest question to be the last question, Brian. But for someone who has a limb length discrepancy, let's tie this back to gravity, okay? So when someone has a leg that is a little bit longer, the longer leg will always have longer contact time. So that means that they have a longer exposure period to gravity, to vibration. So we oftentimes will see certain injury patterns on the longer leg when they have an asymmetry. And it's, of course, the leg that's on the ground longer that will get hurt. Okay, it could be in the knee, it could be in the foot, it could be in the hip, right? So kind of along that whole spectrum. Now, if we have a limb length discrepancy, you always want to know, is it structural or is it functional? Okay, the way that you differentiate for sure is I send my patients to get what's called a scanogram. The scanogram is either an X-ray or a CT, and it's them actually measuring the length of the bones, the angles of the neck of the bone, and then they will do an actual mathematical calculation and say, your right tibia is 5 millimeters shorter than your left, blah, blah, blah. And then you know for sure it's structural. Okay. I never do just a tape measure assessment or like a standing assessment and kind of eyeball it subjectively in the office, because there's so much human error in that I like to know for sure. And then if that is the case, that it is structural, then you have the conversation with them is, do you want to use a lift? Do you want to use an entire foot lift, not a heel lift, but a whole foot lift? And if you do, then if you use the entire foot lift, then you want to understand just kind of the impact of that. If you are going to use some sort of lift, you always correct only 50% of what the limb length discrepancy is. So if you have a 1 centimeter or a 10 millimeter difference, and I'm sorry that I'm referencing in metric, but medicine is always metric. So I honestly can't do the conversion to inches, but so you have a 1 centimeter or 10 millimeter difference, then your lift should be 5 millimeters. You would never put a 1 centimeter lift in a shoe. You also can't put that much of a lift in a shoe anyway. But I just want you to understand that, okay? And then of course the lift goes on the shorter side. Now, if it's functional, completely different. You do mobilization and you try to get them into a more balanced position by derotating the pelvis and opening up the obliques and the QL and stuff. Okay, great last question. Awesome. I understand that people may need to jump off. Super fast is called rapid fire. How long did the insoles last? They last for 1 year, roughly 6 months to 1 year, which is kind of the average of what insoles last. Ash, you're a little late. I do apologize. The tongue to palate is part of the deep front line. I'm actually going to do another webinar, Ash, so I know people have to go. I'm going to do another one that is called From Toe to Tongue, and I'm going to go into that even more. Okay, so hold me to that. We'll do that in the next couple weeks. Okay. Scanogram is done by a radiology facility. So you have to just send them out. It would be the facilities that do x-rays, MRIs, ultrasounds, CTs, mammograms, like a true radiology facility, they'll do a scanogram. Okay? All right. Excellent. Great. So thank you guys so much. I really appreciate you tuning in. This will be recorded, or the recording will be found on the YouTube channel. It will also be found on Teachable. And then please